Do you have foamy or bubbly urine? I'm Dr. Frita, and today I'm giving you the top 5 causes you should know. Tell me, when you make urine, do you ever notice that it has a few bubbles, or maybe a lot of bubbles? Is it outright soapy or sudsy, or do you have straight up thick foam in your urine? Well, before you just flush it and forget it, you should know that for many people, foamy or bubbly urine is actually a warning sign of kidney disease. It's true. I'm a board-certified kidney doctor, and I can tell you firsthand that for many of my patients, their first warning sign that they had kidney disease was that they had bubbles in their urine. Over 35 million Americans have kidney disease, and most don't even know it. So don't you think it's important for you to know all of the warning signs and symptoms of kidney disease that you can? Well, of course, I think so. And so if you're someone who is listening to me and you have foamy or bubbly urine, keep listening, because today I'm giving you some evidence-based information on the top 5 causes. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. I'm Dr. Frita. Please go ahead and give this video a like as we get started, because I'm about to give you some evidence-based medical information. All right, let's jump on in. Here are 5 causes of bubbly urine. Oh, make sure you stick around for cause number 5, because it might surprise you, and it can be so easy to jump to conclusions. Number 1, proteinuria and kidney disease. When you have protein in the urine, it's called proteinuria. And guess what? It's not normal to have proteinuria. It's actually normal to have 0 or very low amounts of protein in the urine. And if you actually have proteinuria, then that is a warning sign that something is not right with the kidneys, okay? And that you could have kidney disease. So here's the deal when it comes to the kidneys. You have these different kidney functioning units, or glomeruli. You're born with about 1 million in each of your kidneys, and the glomeruli have a negative charge. Okay, so let's take it back to science class. Remember, negative repels negative. So if you have 2 things that have negative charge, they repel each other, and your kidney cells have a negative charge, and guess what? So does protein, specifically albumin, a type of protein. So typically, if you have the proper charge in your kidneys, a negative charge, then as your blood is filtered by your kidneys, that negatively charged albumin is going to be repelled, and it's not going to get through the kidney barrier. Well, if you're actually leaking albumin or protein in your urine, then we know that something is wrong with the charge of your kidney cells, which lets us know that this proteinuria is a hint that you have kidney disease. Also, just the structure of the kidney cells, the structure of the glomeruli, they are laced in such a way that it prevents you from leaking protein. So again, if you're leaking protein, it could also mean that something is structurally wrong with your kidneys, okay? So once you have all of this protein in the urine, it can cause bubbles, and it can even cause foam. And I'm talking like a thick white foam, kind of like in beer commercials. You know, you'll see them pour the beer and you have all this, the beer on the bottom and all this white foam on top. Yeah, if you have a lot of protein in your urine, it can cause a foamy urine, and this is an issue. There are many kidney diseases that can result in protein in the urine and subsequently bubbly or foamy urine, such as diabetic nephropathy, FSG or focal segmental glomerulosclerosis. You can also have a lupus nephritis, IgA nephropathy. The list goes on and on. The important thing to remember is that if you have bubbly urine, it could mean that you have protein in the urine, which could mean kidney disease. And if you have a lot of protein in your urine, you could have nephrotic syndrome. Make sure you check out my video on nephritic versus nephrotic syndrome after you finish watching this video. So here's what to do if you suspect that you have proteinuria as the cause of your bubbly urine. Check your body out for different symptoms, like do you also have swelling in your feet and ankles, in your face? Are you noticing that you have some other signs or symptoms of kidney disease? And either way, if you have this bubbly urine, you want to make sure you consult with your doctor right away and ask them specifically to test your urine for protein and to also just give you a full history and physical to see what else is going on. I love sharing medical information with you, and guess what? I have something I want to share with you for free. And who doesn't love a freebie? I want you to download my free PDF on 10 healthy habits for a better you and a better life. These are the habits that I use myself every day as I try to live my healthiest and happiest life. So make sure you click the link in the description or go to my one-stop shop, dr.frita.com, to download your copy today. Number 2, complications from diabetes. Yes, would you believe that diabetes is actually the number 1 cause of huge amounts of protein in the urine, or nephrotic syndrome? And I can tell you firsthand that diabetes is the number 1 cause of kidney failure. So you can imagine that I have lots of stories of people who have come to me with bubbly urine, and I've been the one to actually diagnose their diabetes. So here's the deal. When you have high amounts of sugar in your blood, or hyperglycemia, this high blood sugar is actually toxic to your kidney filters, okay? It's toxic to your kidneys. And so when this high blood sugar causes damage to your kidney filters, then you no longer have that proper blockage that keeps the protein or the albumin from leaking into your urine. And so diabetes or high blood sugar can lead to kidney filter damage, which can lead to protein in the urine. And again, this protein can lead to bubbly or foamy urine. So here's what you do. First of all, you want to make sure that you keep your blood sugar under control. Make sure that you see your primary care physician regularly. Ask them to check your blood sugar, which is a test that's typically done just in a BMP, basic metabolic panel, your routine blood work. Also, ask your doctor to check for a urinalysis to see if you have any protein in your urine. And very importantly, ask your physician what your hemoglobin A1C is. You want to know if you have pre-diabetes, or if you're totally normal, or if you actually have diabetes. And this is just routine, whether you have bubbles in your urine or not. If you have bubbles in your urine or foamy urine, and you know that you have diabetes, then you want to check your blood sugar right away. And again, go to your doctor, ask for a blood sugar test, ask for your hemoglobin A1C. If you don't have diabetes and you have bubbles in your urine or foamy urine, then still you want to go to your doctor and make sure that you don't have diabetes or pre-diabetes. So again, ask for those tests. Still make sure that you get a comprehensive history and physical, because bubbles and foam in the urine, it's not normal. Question: on a scale from 1 to 5, 5 being the most confident, how confident do you feel about telling the difference between harmless bubbles versus warning sign foam? Please comment down below. Number 3, urinary tract infections, or UTIs. Yeah, this is a little known fact that having a UTI can actually lead to bubbly or foamy urine. This is how. When you have infected urine with bacteria, then the bacteria and the white blood cells and the mucus can sometimes cause you to have bubbly urine. It's true. And even if you have a bacterial infection or a UTI and your doctor does a dipstick, then sometimes it can show up as being positive for protein. And so this is an important detail to know, because we know that if you have recurrent UTIs, especially if they ascend or go up from your bladder, through your ureters or the tubes that connect your bladder to your kidneys and up to your kidneys, if you get kidney infection recurrently or pyelonephritis, then over time, that can lead to CKD, chronic kidney disease. And so if you're having bubbles in the urine and you suspect that you're having urinary tract infections, it's important to nip it in the bud so that it doesn't lead to kidney disease. So how do you nip it in the bud? Well, number 1, you pay attention to your body. In addition to the bubbly urine, is the urine cloudy? Does it have a foul odor? Are you having pelvic pain? Do you have dysuria, meaning pain when you urinate? Are you having fever, fatigue? Are you getting little spots of blood in your urine? All of these can be warning signs and symptoms of a urinary tract infection. And so if you have these signs and symptoms combined with bubbly urine, then certainly you want to go to your doctor to get a urine culture to see if you have a urinary tract infection. The good news is that urinary tract infections, UTIs, are quite treatable. If they're caused by bacteria, then you can get treated with antibiotics. The key is not to ignore the symptoms. Please don't tough it out. if you see bubbles in your urine and you suspect that you might have a UTI, call your doctor immediately and get treated. Number 4, dehydration and concentrated urine. Yes, being dehydrated, not drinking enough water can lead to bubbly urine. It's true. And let me tell you, I just saw a patient last week who had this problem. He was actually a very health conscious patient. He exercised, he actually ate a lot of protein, and he was seeing me kind of for preventive measures because he had a family history of kidney disease and he had some bubbles in his urine. And so he was concerned, okay, could this be a problem? So, I did my history, my physical, we did lab work. He did not have any diabetes. Okay, his hemoglobin A1C was within a normal range. And overall, he was pretty healthy. But once I started talking to him, I asked him about his water intake, and he was only taking in about 20 ounces or maybe 32 ounces of water a day. On top of that, I mentioned that he was a healthy guy. Well, he was working out like 5 days a week, okay, doing strength training, doing cardio. And so what does that mean? He was probably sweating and dehydrating himself, and he wasn't replenishing, he wasn't hydrating. And so once I did a urinalysis and I saw that he had a high specific gravity in his urine. Okay, if you go to your My Chart and you look at your urinalysis, you'll see an SG, specific gravity. And if it is high, that could mean that you have a concentrated urine. His was high. And so what was happening is that dehydration and concentrated urine was causing him to have a bubbly urine. So here's the science behind it. When your urine is concentrated from you not drinking enough water, then you get a high solute concentration in the urine, okay? It's just super concentrated. So when you have a concentrated urine and a fast urine stream, this traps air, which causes short-lived bubbles in your urine, in the toilet, okay? So what to do about it? Well, give yourself a hydration test. Start drinking adequate amounts of water. Try that for 2 or 3 days. And if you see that the bubbles go away and your urine is less concentrated, then very likely that's the answer. If even after drinking the proper amounts of water, you still have bubbly urine and concentrated urine, then you definitely want to consult with your doctor, especially if this bubbly urine and concentrated urine is paired with other warning signs and symptoms like high blood pressure or fatigue or decreased urine. If you're making a decreased amount of urine, then you definitely want to consult with your doctor. So how much water is enough water to keep yourself from being dehydrated? Well, it does vary from person to person. For most adults who are generally pretty healthy, then drinking 2 to 3 liters of water per day should be sufficient. So if you think about the typical water bottles, like these 16-ounce water bottles, then drinking anywhere from 4 to 6 of these 16-ounce bottles should be enough water. Or by some calculations, if you drink half of your ideal body weight in pounds, if you drink that in ounces of water per day, then for many people, it's adequate. Quite honestly, the best way to know is to consult with your doctor to find out the amount of water that's proper for you, because if you have heart disease like congestive heart failure, then you might have to be on a fluid restriction, like drinking less than 2 liters a day or less than 1.5 liters a day. If you have chronic lung disease, you might be on a fluid restriction. Also, if you have very advanced kidney disease, certainly if you're on dialysis and you have end-stage kidney disease, then very likely you'll be on a water restriction. Consult with your doctor. Also, be sure to watch my video on the benefits of drinking water after you finish watching this video. Number 5, now this is a real cause of bubbles in the urine, and I'm telling you, I have had patients who come to see me because of bubbles in the urine, and we found out that their cause was number 5, cleaning products in the toilet bowl. I am so serious. Some of these cleaning products like a blue disc or bleach tabs, when they're in there, they can cause literally just soapy suds. And so when your urine stream hits the toilet, it will cause bubbly urine. And if you're not suspecting it, it can freak you out, especially if you've been watching my videos and you know that foamy urine can be a warning sign of kidney disease. Here's what happens. The surfactants in these toilet bowl cleaners will act as a stabilizer to bubbles, and it will give you a bubbly urine even if there's absolutely nothing wrong with your kidneys and nothing wrong with your urine. Now, I don't want you to hear this and just blow it off and be like, oh yeah, it's probably just toilet bowl cleaners. No, I want you to make sure that this is the cause and that it's not something else. So how do you do that? Number one, make sure you're hydrated, okay? Just let that be on the top of your list all the time. Make sure you're well hydrated, and then clean your bowl to the point where there's no more toilet bowl cleaner, okay? And this might take a couple of days just to make sure that there's no fresh toilet bowl cleaner. You can also do a bit of a clean bowl test if you urinate in other toilets, public toilets, friends' toilets, and just kind of do a little personal survey. If it's only happening at your toilet with your toilet bowl cleaner, then it might just be that. The bubbles might be from the toilet bowl cleaner. However, if these bubbles persist, again, I don't want you just to assume that it's a toilet bowl cleaner. I want you to be sure. If the bubbles persist, then please consult with your doctor and get your urine tested to see if you have protein in the urine, diabetes, urinary tract infection. See if you have one of these other causes. But yes, sometimes people jump to the conclusion, and honestly, it's just because you've been cleaning your toilet. Question: which quick check would you try first? Hydration day, a clean bowl test, or would you call your doctor for a urine test? Please comment down below. So there you have it. These are 5 of the top causes of foamy or bubbly urine: proteinuria, diabetes, urinary tract infections, dehydrated or concentrated urine, and toilet bowl cleaner. And remember, if you're having any of these, signs where you're seeing the bubbles in the urine, don't just, blow it off or say, it's no big deal, especially if the bubbles in the urine are paired with other warning signs of kidney disease. Make sure you consult with your doctor and consult early, because early detection of kidney disease leads to better outcomes. And remember, I am a board certified kidney doctor. Taking care of kidney patients is what I do day in and day out. And so if you actually want to have a consultation with me, you can, because I do offer a telehealth concierge medical service where I can talk to you, get your full history, and give you medical information from anywhere in the world. Just click the link in my description or visit my one-stop shop, dr.frita.com, and book your appointment today. I certainly appreciate you for watching, and if you found this video to be helpful and informative, be sure to like it and to share it with someone you care about. I want you to make sure that you make your health a priority and do your best to live your healthiest, happiest life. I'm Dr. Frita.